Hello, I wanted to talk to you today about surgeries and what can happen to the body when you've had a surgery. So I'm going to talk about C-sections, I'm going to talk hysterectomies, anything gallbladder removal, hernia operations, anything abdominal surgery related. So I saw a lady a few days ago and she was about 6 weeks post hysterectomy. So she had her hysterectomy because she had fibroids, and the fibroids were kind of on her left hand side. So she was still very swollen, and it's quite sore on that left side where the fibroids were, where they had to do a little bit more work. And when she sat in the chair, I'll just move myself back a little bit more, her posture was like this. So she'd been like that probably for the whole 6 weeks post surgery. And her language was really interesting. So the words that she was using a lot about, I need to protect myself. It was all about, I don't want to do too much and I want to protect myself. So it was all about that protection. And I totally get that. I totally get that you've had this surgery and your body and your brain then goes into that guarding strategy. I need to protect myself. I'm sore, I'm tender. You kind of go like this and your brain kind of shuts off and goes, yep, we need to protect that. There has to become a stage where myself as a therapist or other people as therapists help you to go from this to this again. And we need to help you feel safe. We need to help you do it in a way that you feel in control, and in a way that your brain allows you to go, I'm okay, I'm safe, I feel protected even when I'm open. So what happens is if we spend too long in this position, what then happens is we get really tight through pectorals, the chest, the shoulders can then start to pull and round in. My breathing alters. I cannot take a nice deep breath when my diaphragm, my intercostal muscles are shut and closed down. My tummy muscles, they're not functioning. They might be too tight because I've shortened everything. My hips, my psoas muscle, my hip flexors, they're going to be probably super tight as well. So if we think about that whole front line, my job as a scar massage therapist and as a core fascial release body worker is to get that fascia and that connective tissue to open up, so that actually you can take a nice deep breath, that you can function. That's my main priority, is that I want you to function and still feel safe and still feel protected, so that your body doesn't have to go like this and guard. So that is my number one job, and it's why I really love working with ladies who've had hysterectomies, C-sections, any other abdominal surgeries, with the tools and techniques that I have, and the experience and the knowledge that I have as a therapist. It's an absolute honour to work with these women to help them open up and to feel safe and to feel protected, and work with the nervous system and the brain to allow that to happen in a nice supported space that doesn't feel clinical, where you can deal with the trauma that's happened, not just physically but mentally and emotionally, and I can help you feel stronger and to function better and be able to walk around with no discomfort. So if that's something, I hope that's explained a little bit about the body and the brain and how we automatically go into that guarding strategy because our body and our brain is trying to protect ourselves. But ultimately, at some point, we need to get you out of that, because that's when dysfunction takes place, pain, and we need to help you recover in the safest way possible. So if you have any questions at all, if you'd like to book in for either a massage or a recovery program, please get in touch. I'd more than happy help you recover. I don't think there's enough support out there for ladies who are having surgeries before, so pre-rehab, pre-knowledge to know what to expect, how you can help yourself beforehand, learning what you can do straight after the surgery, and then helping you to recover in those first early weeks and months. So this is what I'm really passionate about and what I really want to help as many women with as possible. So get in touch if you would like any more information. Okay, bye.